Okay, this is our abdominal viscera model, and we can use it to show both arteries and veins within the abdominal region. Let's see if we get the light a little bit better here. All right, I see my stomach, and on the surface of the stomach is the gastric artery. That gastric artery is a branch that comes off of the celiac trunk, and we'll look at that in just a moment. But let's get our stomach out of the way. Behind the stomach, I see my pancreas, I see my spleen, and I see some duodenum. I also see liver, and I see gallbladder. So I see my abdominal aorta, the large vessel here, and my celiac trunk coming off of that abdominal aorta. Here are the three branches that come from that celiac trunk. The short little nub here is the gastric artery. This branch heading over to the spleen is the splenic artery, and this branch heading over to the liver is my common hepatic artery. If I move down below the pancreas, I see my superior mesenteric artery. It's coming off the aorta just behind the pancreas, and next to it, my superior mesenteric vein. Now I can see my inferior mesenteric artery also, but it's a little bit tricky. Oh, there we go. I can see a little nub of it right here. That's my inferior mesenteric artery supplying some of my large intestine. I can still see my abdominal aorta, and I see it split here into the common iliac arteries, right and left. And then I see that common iliac artery split here into external iliac artery and an internal iliac artery. Now, the veins are sitting right next to those arteries, right? We've got our inferior vena cava, and then we have those two common iliac veins. All right, if I look at the stuff going into the liver here, we've got three things that are going into the base of that liver or coming out of the base of that liver. We have, again, our hepatic artery. The light lavender thing back here is my hepatic portal vein carrying, for lack of a better term, dirty blood into the liver for filtration. And then my green structure over here is my bile duct. So those things are called the hepatic triad or portal triad, and they're going to be entering the base of the liver. I see my inferior vena cava, and I can see some hepatic veins, which are carrying clean filtered blood from my liver into the inferior vena cava, where we can then return that blood to circulation. We can return it to the heart. If I rotate around to the posterior side of this model, so now I'm looking at the back of my abdominal aorta and my inferior vena cava. What I see very nicely here are these little paired arteries and veins. So there's one coming off this way, one coming off this way, and these are going to be our lumbar vessels. And those lumbar vessels are going to be supplying the body wall. So things like your external and internal obliques, transverse abdominis, and what have you, they'll rotate around towards the front of the body. I can also see some vessels here and some vessels here. Now they're going to two organs that are not included on our chart, on our model. They're going to the kidneys. Those are renal artery and renal vein, and again, renal artery and renal vein. In addition, when I'm looking over here at the back of the spleen and the back of the pancreas, I can see both the splenic artery, which came off of that celiac trunk, and I can see the splenic vein. In addition to the splenic vein, I can see the inferior mesenteric vein, which often will connect to the splenic vein before going into the hepatic portal vein.